Hello and welcome to the IEA channel. I'm Emma Revel, Head of Communications at the IEA, and we're recording on the 15th of April 2020, remotely of course. The IEA is producing some excellent content with new podcast videos and webinars, as well as our traditional briefings and reports to help you understand the impact coronavirus is having on the global economy. You can subscribe via YouTube, Spotify, Apple or Podbean, and check out the new IEA daily newsletter to ensure you never miss a thing. On the 23rd of March, Prime Minister Boris Johnson announced a nationwide lockdown. Non-essential stores were to close, people should only leave the house to buy basic necessities, collect medications, do 1 hour of exercise or support vulnerable friends and family. The lockdown was initially to last for 3 weeks before being reviewed. We now hover around the 3-week mark and no firm decision has been made, but noises from government suggest we shouldn't expect things to return to normal anytime soon. But is that the right decision? Are we striking the right balance between protecting lives from coronavirus and managing the health impacts of a lockdown? Mental health issues are being exacerbated, there's serious concern about those experiencing domestic abuse, and there is anecdotal evidence to suggest people are delaying seeking medical attention for fear of contracting coronavirus. How long can businesses and the wider economy survive if consumers aren't spending and people can't get to work? Joining me to discuss this today are Julian Jessup, Economics Fellow at the Institute of Economic Affairs, and Sam Bowman, the Director of Competition Policy at the International Centre for Law and Economics. Welcome to both of you.
Good morning.
Morning.
We haven't had a decision yet on the UK government extending the lockdown, but most people are expecting at least a few more weeks, perhaps with some minor relaxations. But there are also growing voices arguing that lockdown may cause more damage than coronavirus in the long term. Is there merit to that argument, and do you happen to agree with it? We'll start with Julian first.
Well, first of all, I think it's one of the most difficult questions that any policymaker, whether they're an economist or a health expert, has ever had to face. I've written quite a lot about this, and I found myself using the expression on the one hand, on the other, over and over again, something economists are not supposed to do. But I think genuinely this is a very difficult call to make. My own feeling is that the balance of risks suggests that we should err on the side of keeping the lockdown in place for longer rather than ending it sooner. Now, lots of factors that go into that. I think, first of all, the risk of letting the pandemic run out of control are so huge that we should do everything that we need to prevent that from happening. But also, if you look at some of the history of these sorts of crises, there's a lot of evidence that it's worth taking quite a big hit in the short term to economic activity in order to protect lives, but also to make sure the long-term consequences of coronavirus panic, whatever the pandemic might be, are less than those otherwise have been the case. Also, it's a very difficult balance in terms of the health impact as well. Bizarrely, there's some evidence that short-lived economic downturns can actually be good on balance for the nation's health. This is a surprising result. Obviously, there are some important negatives. Mental health, for example, you've mentioned already. But there are also fewer deaths from things like road accidents. So short-lived recessions can actually be okay for the nation's health. So there are lots of factors there on both sides. But I think the balance of risks does point to keeping the lockdown in place for longer.
I mean, we've seen evidence that actually Priti Patel, for example, the other day said that there's been a fall in certain types of crime, obviously because people aren't going out so much. So, Sam, do you think there's merit to the argument we need to end this lockdown sooner rather than later?
I think there's merit in the abstract sense that it's worth thinking about that question. It's certainly important to it's certainly important to remember the trade-offs of the policy that we're going for. This is really, really unprecedented, and the real economic costs, I think, are very, very, very significant. Having said that, I agree with Julian, and I think to add to what he said, I think often people, when they approach this question, they're forgetting about the counterfactual. The thinking about kind of what would be happening if we didn't impose this lockdown. I don't think the counterfactual is business as usual. If we look at countries that haven't imposed a significant lockdown, so for example, Sweden, for example, there's a lot of individual decisions being made to kind of take kids out of school, to work from home, to not go out to bars and restaurants. And when we look at the UK before there was a lockdown imposed by the government, a lot of restaurants were just getting much, much less business. A lot of people were staying home. So there was a lot of kind of voluntary lockdown or social distancing taking place anyway. And that's going to have a similar economic effect, just on a smaller scale. So it's important to remember that that's the counterfactual. It isn't a question of should we have the economy going as usual or should we have the current situation. It's two pretty unpleasant situations. albeit in this one, in the one that we've chosen, possibly, hopefully, it looks as if we may be getting some kind of control over the spread of the virus. To me, the point of this lockdown is to buy ourselves time. Partly, it's about buying ourselves time to understand the virus better. We now know things about the symptoms. For example, loss of sense of taste, and loss of sense of smell were not things that we really knew before, which appears to be one of the symptoms. These were not things we knew when the virus was in China. We're learning about how to identify it better. We're obviously, hopefully, rolling out much more in terms of testing, much more in terms of masks. People are getting, I think, a little bit more aware of the individual behaviour that they need to do to stay apart from each other. And I think the goal should be, and the kind of exit strategy from this current situation, is certainly not going to be going back to usual, going back to normal, because we'll just have a repeat of the outbreak. This disease is highly contagious. It's still out there. The goal should be figuring out how we can move to a kind of Hong Kong or South Korea or Taiwan style situation, where they have put in measures that certainly are different to life as usual, but allow people to go to work if necessary, allow people to go out. In fact, in Hong Kong, in some places, allow people to go out to restaurants and bars and things like that. Obviously running at much lower capacity than usual, but all of these things take time. We still have a shortage of protection equipment. We still have a massive shortage of testing. We still have a massive shortage of the kind of basic things we would need to get to that state. So for me, the question is kind of how long is it going to take for us to get there? What are the policy levers we can change to get there more quickly? And how do we make sure that people actually employ those things and understand that they can't just go back to business as usual if and when the lockdown ends?
Interesting. So we seem to be in agreement that actually this lockdown needs to continue. Coming out of it now would have serious negative impacts. But do you think we've accurately assessed, or is it possible to accurately assess the impact the lockdown is having? Not just the economic costs of the government's job support measures for businesses and individuals, but also the impact on people's health. Because even if this is something that we need to continue doing, we need to be honest about the impact that's going to have as well, right?
Well, shall I start with if I start with the economic impact, I think it's important almost to turn the normal logic around on its head. So yesterday, for example, the Office for Budget Responsibility was talking about a fall in GDP as large as 35%. And obviously at face value, that's a bad thing. But in these particular circumstances, we actually almost want a recession because we want people to stop doing what they would normally do. I think the size of the fall in GDP itself, whether it's 25% or 35% or some other big number, is less important than two other things. The first is whether or not we're able to protect businesses and jobs in the meantime, so that as and when the emergency measures can be lifted, the economy can quickly reboot. And that's where those economic policy measures like the cheap business loans are so important to the job protection scheme. And I think, frankly, it's almost worth paying any amount of money to make sure that those schemes are effective and the economy can quickly get back to normal again. The second broader question, though, is the very difficult one about the pros and cons in terms of health. Every crisis is different. It's clearly different, for example, the Spanish flu pandemic or the Great Plagues of the 16th and 17th century or the Black Death and so on. But we can look back at some of those precedents, and there does seem to be plenty of evidence that a swift policy response is more effective, both in terms of protecting the economy, but also in terms of saving lives. And I think that's the right way to look at it. On the other hand, to use that awful expression, we do need to be aware that that an economic lockdown is having costs. I think in particular people are increasingly aware of the fact that people are not using the NHS for non-coronavirus related problems as they would normally do. So there's a lot of GP appointments being missed. There's a lot of patients with other also very serious conditions who are not getting treatment. There's a natural human tendency to focus on the most visible casualties here. Those people are actually dying of coronavirus, and whether that's in hospitals or care homes. And I think it's absolutely right that we should be very aware of what's happening to them. But there's also some hidden casualties of the lockdown itself. We need to be very aware of that as well. I personally think it's too soon to make a firm judgment about that. I think it's right in this case to sit on the fence and keep the lockdown in place for longer. But we need to watch what's happening, not just to those people who are suffering or at risk from coronavirus, but for other vulnerable vulnerable people as well, who might have hidden health problems that maybe are not making the front page of newspapers every day.
Yeah, I mean, Sam, one of the statistics that jumped out at me is the number of people attending A&Es down by over 50%. That can't all just be down to coronavirus. And we've even had a fall in referrals for cancer treatment. Well, obviously, cancer is unaffected by coronavirus. People should still be needing these referrals in the same numbers. So obviously, that's a concern, that people are staying away from hospital.
Yeah, and I want to be careful about commenting on any of the health effects, since it's a million miles away from any area of expertise of mine. But we can look at excess deaths as one measure of how bad on the round things are. So we can compare how many people are dying in the last few weeks to how many people have died during this period over the last 5 years. And there's a phenomenal increase in the overall amount of deaths that's going on. It's absolutely astonishing to look at the chart. And what's interesting is that of the roughly kind of 6,000 extra deaths that we've seen in the past week compared to previous years, only more just over half of those people have COVID registered on their death certificate. So there's a huge increase in the number of deaths that are taking place that don't have COVID on the death certificate. Now, my suspicion is that that's probably people who, and again, I want to be clear, I'm not an expert on this, but there's probably quite a lot of underreporting of COVID cases. There seem to be a lot of people dying in care homes. There seem to be a lot of people who are dying of related illnesses, perhaps exacerbated by COVID, that we can't pick up in the COVID measurements, but we are picking up in the overall death measurements. So I think we have to be careful that, yes, of course, we need to be wary that people are dying of things unrelated to COVID, and perhaps that's included in those figures as well. But we also may be undercounting the number of people dying of COVID. And all signs from other countries and from the UK so far point to this being a phenomenally dangerous disease, a phenomenally infectious and a phenomenally deadly disease to people who get it. Not just people who are close to death already, which is a widespread misconception. People who are very healthy, people who are young, people who are middle-aged. It's extremely deadly to those people. So while we have to, of course, and it's kind of outside of my realm of expertise to make any kind of estimation about the relative numbers of people dying of one versus the other. The overall aggregate statistics do seem to suggest that this is extremely bad, and we should be really, really careful of anything that causes us to try to kind of downplay the badness of it. The other point that I think is worth making is that in general, and this isn't really the time to get into a discussion about NHS policy or anything like that, but in general, people like me at least think that one problem that the NHS has is that because it's free at the point of use, you have a kind of over demand. You have excess demand for things. So, for example, doctors' waiting rooms might have some people in normal times in it who probably shouldn't be there, probably should be using the NHS call line, or probably should be speaking to a nurse rather than a doctor, whatever, because the price is zero, the financial price is zero. Unfortunately, now the total cost of going to the doctor is very large because you have a risk of contracting COVID. So now we've probably swung the other way, where there are, instead of too many people going to the doctor and waiting rooms and so on, we have too few people going to the doctor and waiting rooms and so on because of this massive extra cost of the risks. So it's very, very difficult to make a comparison either between normal times, where typically I think we possibly have too many people going to A&E and too many people going to doctors' waiting rooms, where compared to now, where it may be completely rational for them not to go, but compared to a world where we didn't have COVID, we would like many more people who are not going to A&E and who are not going to the doctors' waiting rooms. Although I presume most doctors' waiting rooms are closed now, but we would like those people to be going. It's one of these kind of boring and unfortunate answers, which is it's very, very, very difficult to tell. We just don't have the data. Here are some kind of interesting observations, I think, but it's impossible, I think, without some serious modelling and much better data than I have available to make, and much better expertise than I have available to me to make judgment like that.
It's still probably too early in the crisis to know exactly, an accurate picture.
I mean, just to repeat myself, really, the really important thing is to not downplay the badness of this disease. It's extremely bad, and every attempt I've seen to kind of quantify, to kind of suggest that the lockdown isn't worth it, has made really wild and often completely inaccurate judgments and assumptions about how either how many asymptomatic cases there are, or the average age of people who are getting it and dying of it, or lots of other things like that. And it may be that COVID causes permanent damage to people that we haven't detected yet. It may be that there are lots of other costs that we haven't picked up yet. So here is one of these cases where being safe, really better safe than sorry, and the kind of precautionary principle really does apply.
Well, that was the next thing I was going to ask, actually. Both of you have mentioned that people who are generally in favour of easing the lockdown are potentially misreading statistics on life expectancy of those dying from coronavirus, or suggesting that people who are dying are already elderly or had limited quality of life. You both suggested that's actually a misreading of the statistics. Julian, can you tell us a bit more about why you think that is?
Yes, well, I think initially a lot of people made some what now look like quite complacent assumptions about the impact of coronavirus. I mean, some people, for example, assumed it would be no worse than the seasonal flu. Others focused on the fact that it seemed to be most likely to impact elderly people or those with existing health conditions. Now, there's a debate to be had about, of course, whether the fact that it might only be elderly or otherwise vulnerable people that are susceptible to this disease, whether that fact actually matters. In a sense, it does, because the conventional health analysis would normally say that you care more about younger people than you do about older people who are near the end of their life. But against that, of course, people dying of coronavirus, even if they are elderly and already facing end-of-life care, that's a horrible death to consign anybody to. Particularly if they're going to be stuck in a converted conference centre somewhere in East London or something. It's important, I think, not to downplay that. So I think there are a lot of cosy assumptions that people made at the beginning that are proving to be wrong. There's one particular point that I think is becoming more and more clear as a concern, which is the possibility that the NHS is so overwhelmed with coronavirus patients that it can't actually end up treating anybody at all. So even if you thought that coronavirus was a fairly mild condition limited to a relatively small amount of people, it could still be severe enough in terms of the number of patients that it could overwhelm the NHS completely. And a lot of the government strategy, of course, has been about preventing that from happening. But at the end of the day, the only way to escape from this is going to be to develop some form of herd immunity, as it was originally called, whether that's through the natural process of more people catching it, or through some sort of vaccine, or some combination of the two. But in the meantime, there's so many unknowns about coronavirus. It does seem to be much more pernicious and dangerous to many more people than we originally thought. So again, that sort of errs on the side of caution to protect lives and to protect the NHS.
Sam, is there anything you wanted to add to that?
Yeah, I think it's right. I don't think that we're the people to make it to kind of attempt quality adjustments or anything like that. But I think it's worth noting that the average life expectancy in the UK of people who get to quite an old age, people who get to the age of 75 or 80, is pretty good. If you reach the age of 80, your life expectancy is then 88. That's quite good, and perhaps quite a lot longer than some people might be guessing. And also, the quality of life for people at that age is a lot better than some people seem to be estimating. The way we estimate quality of life and the way we do quality of life adjustments are to ask people about things like their mobility, how happy are they able to care for themselves, things like that. And all of these things help us to make really tough decisions between prioritizing care for people, for example, who are living very, very painful lives, and prioritizing care to people whose lives are much richer. But when we look at people, the average people who are in the kind of 70, 80 age group, their quality of life is very good, and it's not that much worse, according to these kind of metrics, than people who are in their 30s or 40s or 50s. It's lower. They have mobility problems on average. They have perhaps problems with pain, for example, on average. But on the other hand, their mood is generally better. Elderly people tend to be happier than people in middle age, and so on. So there's a really, I think, bad assumption that's made that not only are people really who die of coronavirus close to death anyway, which I think is a mistake, but also that their lives aren't really worth living either, which I think is very, is not quite sinister, but getting to the point of being sinister, when the data says something quite clearly otherwise, that their lives in general, on average, are worth living and are very, very kind of positive and so on, even if they have certain problems with mobility, for example. So I think it's really, really important I think we probably can make some kind of cost-benefit analysis, but I don't think that any attempt that's been made so far has factored in anything like the sorts of information that we would need to factor in order to get that. And to kind of reiterate a point that Julian made earlier, it's really important to understand how unusual this recession is. It's possibly the first self-inflicted recession, the first recession that we want as a matter of government policy, certainly of our lives. Possibly the first one ever that I'm aware of. And what that means is that if we approach it in the right way, and if we put businesses into stasis, if we treat the economy at the moment like it's kind of summer in France, or the kind of off season in a holiday town, putting businesses into stasis and kind of reviving them and aiming to be able to kind of bring them back into business with the same contract arrangements, the same employment arrangements, things like that. When things get back to relative normal, then it may be a much less painful recession in the long term, and maybe a kind of real one-off, short, sharp shock that we can control. Now, that's very optimistic, and in any kind of policy, there are lots of things that can go wrong. But I agree with Julian that it would be a mistake to look at, let's say, a 20, 25%, 30% contraction in GDP in one quarter, and to think, oh my God, this is the Great Depression. Oh my God, we're going to spend 15 years trying to get out of this. It's very, very different to instances like that in the past.
How much do you think the length of this lockdown, obviously it needs to depend on scientific and health evidence, but how much do you think people's willingness to tolerate it is a factor? Because there were suggestions several weeks ago that Brits wouldn't accept their liberties being strongly curtailed, but a YouGov poll that came out on the 14th of April found that 48% of people support current lockdown conditions and 44% of people think government hasn't taken a sufficiently tough stance. So actually, people are much less worried about being able to get out their houses and quite happy to sit it out, I suppose. Do you think that will last, or do you think a similar poll 3 weeks from now is going to show we're all desperate to make a break for the pub, Sam?
I think that it probably will last for now. I think that there's so many kind of unusual paradoxes and surprises at the moment. I mean, I never thought I would be in favour of a gigantic government scheme to bail out workers, bail out businesses, and so on. But here we are. There is a common criticism that people kind of in the free market world make of the NHS, which is that it's kind of like a national religion. But one of the nice things about that is that now people can be sort of motivated to do things more than not just out of self-interest, but out of a kind of sense of kind of common interest and a sense of duty. And the government's messaging about protecting the NHS, I think, has been quite interesting. Because if that resonates with people, and if people feel that this institution is something that they are really willing to make personal sacrifices for, then great. Then let's make sure they understand it in that way. I think that we have to remember that the measures that and we'll probably talk about this later, but the measures that the UK government has imposed are much less restrictive than in most European countries that have brought in lockdown measures. And there's also still, I think, a kind of unevenness, a strange unevenness to some of the measures that have been brought in. For a long period, the government was still advising that it was fine to go to work if you couldn't work from home. It was fine to go to work. So you had kind of market traders still going into their offices, still going into the trading floor, and so on. While most other people were effectively in lockdown, and while most other businesses were shutting down. Whereas in other areas, like for example, this thing that we're seeing where people sitting on their own in a park, hundreds of meters away from everybody else, are being kind of hassled by police. We're seeing kind of an unusually excessive and unusually kind of over the top enforcement of the rules. So I think there may be some tweaking needed, and I think we have to be realistic that any kind of policy like this is going to have people being over enthusiastic in imposing it. I am critical of some police forces, and I am critical of some instances that we've seen, but we can't act surprised. This is just what happens when you impose a new policy. People will misinterpret it, or people will over enthusiastically interpret it. So I think the government's job right now should be, what are they looking at? What are the pressure points? What are the things that people are really bristling at and getting annoyed by? And what can we do to make them a little bit less annoyed, so that in the things like, for example, if it gets really sunny, and I mean, it is quite sunny already, but if we get into a point where the weather is really drawing people out, then how do we work with human nature, and how do we work with people's behavior to kind of allow them to do what they want, but without them feeling that they need to either go all or nothing, to just completely ignore the rules, or stay indoors and not get any sun or anything like that. It's kind of adjustments. I think we need to make tweakings, and I think it probably will be. I think my suspicion is that the reason we haven't yet heard about the so-called exit strategy is that the exit strategy relies on the government having the testing equipment that it needs, having enough supply of masks, potentially for the entire population, that we just don't have. And all of these things basically make the government look bad if they commit to. I mean, they've already repeatedly said that we're going to have widespread antibody testing and failed. We're going to have widespread testing of antigens and failed. All of the announcements they've made so far, they've fallen short on. So I can see why the government, for its own sake, doesn't want to commit to saying by the end of May we're going to have X number of tests and we're going to be able to eliminate lots of the restrictions. But we're going to need something like that pretty soon, because people need to understand that this isn't going to be for the next 6 months. Things will be different for the next 6 months. Things will be different potentially for the next 18 months or 24 months, but things won't be quite as bad as they are right now. But we need to understand why that is and why we aren't there yet and when we will be there. And all of those things require some level of the government putting its neck on the line.
Julian, we're beginning to see the relaxation of lockdowns in China, with maybe Spain and Italy following soon. There are other countries like Sweden who didn't follow this path at all and had relatively little government restriction on people going about their day-to-day lives. Do you think these countries will show us the path to follow or not follow when we see how coronavirus develops as they lift restrictions? Or do you think lifting restrictions in other countries will make the British public say, well, why are they doing it and not us?
Yeah, well, I mean, first of all, just to add to one point to what Sam was just saying, I think that the British public will put up with an awful lot, provided they understand why it's necessary. And I think at the moment there is still that consensus there that people understand that these sorts of restrictions are needed. I think the government's daily press briefings are very helpful in that respect, particularly the fact it's not just politicians, but proper health experts talking at these conferences as well to explain why what is necessary. And the important thing, I think, is to maintain that relatively good level of communication, so that people can see why they're being asked to do what they're being asked to do. As to the point about what other countries are doing, I mean, one of the odd things here is that people always seem to be finding some other country and saying, why aren't we doing it like them? So there are those people that we want a tighter lockdown who are looking at France and saying, why haven't we done what France has done? There are others that are looking at Sweden, who obviously haven't imposed a lockdown, and saying, why aren't we doing what Sweden is doing? I'll just make 2 points there. First of all, I actually quite like the idea that there's a diversity of approaches being taken. So we get a chance to understand, why one policy seems to be working and others maybe are less effective. But the second point is there's a big caveat around that. Lots of countries are facing very different problems. So, for example, Sweden. In Sweden, the population is much more broadly spread than in, for example, a big city like London or New York. So, in a sense, sort of social distancing is happening automatically because the people are spread around much more widely anyway. Also, Sweden is not a transport hub in the same way that London is with all its airports. Sweden's not such a big tourist destination. There are lots of big differences between individual countries. Nonetheless, we can at least look at what's happening in countries in Asia in particular. I wouldn't pay too much attention to China because for various reasons I think some of the data there, both the health data and the economic data, are pretty dodgy. But there are other countries like, for example, South Korea and Taiwan that do seem to be further down the road in terms of dealing with coronavirus, that have been able to ease their restrictions a bit sooner, where the economies are starting to recover. In those particular countries, testing seems to be absolutely crucial. They've been able to do more testing, and therefore they've been able to say that some people can get out and about a bit quicker than otherwise have been the case. So there are lessons there to be learned about how the UK should behave when we get more effective testing. But yes, and there are lots of other countries that we can look at and should be looking at, with that important caveat that many countries, the geography and the demographics and other factors are a bit different. So there's no exact parallel to what's happening in the UK.
And to add 2 points to that, the first is that Sweden, I think, which has imposed relatively mild measures, has had more deaths from COVID than all of the other Nordic countries put together. So even granted the things that Julian said, which I think are true, Sweden seems to be having a pretty terrible time of it. And the second point about Sweden is that its death curve is exponential. So it may simply be that Sweden was a few days or a few weeks behind other countries in getting the kind of the initial infections, and that in a few weeks' time, Sweden is really in a disastrous situation. Now, that's a hostage for fortune we don't know, but the point is that it's slightly early to make any judgments about what's going on there. Second point is that, as I mentioned earlier, a lot of European countries' measures were far more restrictive than the measures we've had in the UK. You weren't allowed to go out during the daytime. You needed passports to get around, to go kind of beyond a sort of very short radius around your house. Really, really, really restrictive measures. And in Spain, at least, the so-called kind of relief of these measures is really actually bringing Spain closer to what we're doing in the UK at the moment. So it's not that Spain is becoming kind of more liberal, I guess, than the UK. It's sort of coming now to the UK level. So there's it's important just to remember that the level of restrictions is just much, much tighter in many Western European countries. But yeah, I think that the real hope, the real optimism is that life is reasonably normal in Hong Kong, for example. In Hong Kong, apparently, the current R0, which is the rate of spread, is 0.3, which means that for each person who gets it, on average, they spread it to 0.3 people. So that means there should be an exponential decrease in the number of cases. If we can get to a point like that, that's really, really nice. Now, they have done things like closing schools in Hong Kong. They haven't stopped people from going out. They haven't stopped people from restaurants are operating in Hong Kong. They haven't stopped people from socializing and so on. They have brought in masks. They have brought in social distancing measures. Life isn't usual there. Life isn't normal there, but it's a lot more normal than it is here. So there are lots and lots of things that we can learn from them. But to go back to the point I made at the beginning, a lot of it relies on things like testing, on widespread use of masks, and on things that people may not accept in the UK. In Hong Kong, for example, if you contract COVID, not only are you required to be isolated from everybody, anybody you've spent more than, say, 15 minutes talking to in the last week or so has to be brought to a quarantine camp, effectively a prison, for a period of a week or so, to be isolated from everybody else. And, I know this quite directly because I was supposed to go to Hong Kong. Obviously, I didn't. But the person that I was supposed to be going to visit spent the week that I would have been there in a quarantine camp, in a prison, effectively a prison, because he had been exposed. Thankfully, he was not. He didn't contract it, but he had been exposed to somebody who had COVID. Now, that's very, very effective. That's a very, very proactive way of stopping the spread of the coronavirus. I don't know if people in the UK would accept effectively arbitrary imprisonment to stop the spread of the disease. We can have a debate about whether we should accept that or not, but I don't know if this government would be willing to impose that kind of measure. So there are all sorts of different variables: what's acceptable, what works, what doesn't work. As Julian says, it's really great that lots of different places are trying out lots of different things, because then we can learn. It's kind of one of the brilliant things of having decentralization and having a decentralized response to this. I kind of tend to fall personally on the let's kind of do much more. Let's for example, I think privacy when it comes to social contact tracing, using people's smartphones to identify who's been around people who've had it and so on. I think privacy considerations should be secondary to controlling the spread, but other people disagree, and that's what democracy is for. It's for coming to some kind of consensus among the people at times like this.
Well, actually, that was how I was going to end. I was going to ask you guys both if you could make one change to the UK's current lockdown situation, whether that would be something more restrictive or something less restrictive. What would be the one change that you would want to make? I guess, Sam, yours would be contact tracing.
No, mine would be mandatory mask wearing in public.
Right.
Everybody should be required to wear a mask, and the only limitation to that, the only excuse for that, is that you haven't been able to procure one, and there should be huge resources put into. I mean, we already have a lot of mass production going on, but the evidence that wearing masks stops people who have it from spreading it to others is so strong, and the cost of wearing a mask in public is so low. I think it could do a huge amount of good for a very, very low cost.
Julian?
I think one thing we need to look at perhaps sooner rather than later is a phased lifting of the lockdown, with schools perhaps being near the top of the list. And there's been quite a lot of work done on this, suggesting that school lockdowns actually don't make a significant difference to the ability of economies to recover, or to whether or not more people die of a pandemic in other ways. But having children stuck at home is potentially a good example of the longer term damage that can be done because they're missing out on their normal education, however good online teaching is and so on. So maybe looking at lifting the school lockdown a bit quicker than some other types of lockdown.
Interesting. Thank you very much to Julian Jessup and Sam Bowman. And don't forget, you can subscribe to all of the IEA's output. Either you can follow us on Twitter, on Facebook, on LinkedIn, or on Instagram. You can subscribe to our YouTube channel or our podcasts, or you can subscribe to our daily or weekly newsletters. Just visit the IEA website, iea.org.uk.